In correctional healthcare and leadership, ensuring adequate resources and proper staffing is essential for maintaining safety, quality care, and operational efficiency. In this video, we will focus on 3 key areas that require special attention: women's correctional facilities, reception and classification centers, and mental health units. These environments present unique challenges that demand informed leadership, strategic planning, and a commitment to best practices in correctional health. These facilities aren't just another part of the system, they are the linchpins that keep correctional healthcare contracts viable and ensure proper inmate care. When these facilities lack resources, the entire system suffers, leading to overcrowded county jails, dangerous backlogs, increased liabilities, and worse, preventable healthcare crises like suicide, self-harm, and untreated female reproductive health conditions. Every correctional facility plays a role in public safety and rehabilitation, however, but women's facilities, reception and classification centers, and mental health units require targeted resources due to the specific populations they serve. Women in custody have unique healthcare needs, including maternal care, reproductive health, and higher incidences of trauma and substance abuse. Ignoring these needs leads to higher rates of reproductive complications, untreated cancers, and mental health crises that could have been mitigated with proper care. When a system underfunds women's healthcare, it creates long-term costs not only in lawsuits and liabilities, but in the overall failure of rehabilitative efforts. This is where every individual entering the system should be properly screened, assessed, and categorized to determine their security level, healthcare needs, and appropriate housing. A lack of medical and behavioral health screenings at intake leads to undiagnosed chronic illnesses, untreated mental health conditions, and improper placements that can result in violent incidents or costly emergency care later. Without well-resourced classification centers, county jails become overcrowded with detainees waiting for intake, creating dangerous conditions for both staff and inmates. The correctional system is now the largest mental health care provider in the country, whether we like it or not. But without proper psychiatric care, crisis intervention teams, and suicide prevention measures, we see devastating consequences. Self-harm, untreated psychosis, and suicide rates increase exponentially when these units are underfunded or understaffed. Failing to address mental health issues at intake or during incarceration doesn't just affect inmates, it overburdens emergency rooms, drives up recidivism rates, and creates major security threats inside facilities. Now, let's talk about the business side of things. Maintaining correctional healthcare contracts is about more than compliance. It's about long-term system sustainability. Correctional healthcare providers must work hand in hand with facility leadership and corporate offices to ensure these 3 facility types have the resources to function effectively. If women's healthcare isn't properly managed, lawsuits and federal interventions will follow. If reception centers create bottlenecks, counties will revolt over overcrowding and skyrocketing costs. If mental health units fail, suicide rates rise, public scrutiny increases, and liability costs skyrocket. Correctional healthcare isn't just a service, it's a strategic investment in public safety and risk management. Leaders in this space must advocate for proactive budgeting, hiring specialized healthcare staff, and ensuring legislative compliance to keep these contracts strong and sustainable. One of the biggest challenges correctional systems face today is backlogs, which create delays in intake processing, medical evaluations, and inmate transfers. This is where everything starts to break down. County jails become overcrowded, increasing the burden on sheriff's departments. Individuals sit weeks or months waiting for proper placement, exacerbating untreated health conditions. Transportation bottlenecks slow down the entire system, leading to frustrations for local jurisdictions and dangerous conditions for inmates and staff. This is why we need strategic collaboration between correctional facilities, healthcare providers, and administrative leadership to keep the system moving. Efficiently screening and transferring inmates to appropriate facilities reduces the strain on local jails and ensures offenders receive the medical and mental health care they need before issues escalate. Correctional leaders, policymakers, and healthcare providers, this is your call to action. If we don't prioritize staffing, funding, and operational efficiency in these three critical facility types, we will see preventable tragedies, massive lawsuits, and increased public scrutiny. We need to ensure women's healthcare services are fully resourced to prevent reproductive health crises, properly screen and classify inmates to avoid dangerous delays in treatment and placement. We need to fund mental health interventions to reduce self-harm and suicide rates. Work with corporate healthcare partners to keep our correctional healthcare contracts intact and sustainable. It's not just about compliance, it's about responsible governance, financial sustainability, and public safety. If you enjoyed this video, stay tuned for future videos and many more to come on my YouTube channel and on the O'Neill Perspective podcast, Politics, Power, and Policy.